Dos, tres. Hello, everybody, and good morning. My name is Ricardo Cabrera, and I am the operations manager here at the Latino Chamber of Commerce of Boulder County. And today we have our best friend, Dr. Liz Mendoza from Boulder County Public Health, and we are going to do our biweekly update for COVID transmissions, for COVID vaccinations, and then a general comment about what she's hearing from the ground, from the community about COVID fears and so on. So Liz, good morning.
Hi, good morning, Ricardo. Thank you very much for having me here. Hello, everybody.
It's always a pleasure. You bring good information and a certain je ne sais quoi to the conversation because you are brilliant and awesome. So with that, let's get started and take it away, Liz. Tell us about transmissions in the past couple of weeks for COVID.
Yeah, well, so our county, as well as the surrounding counties, we're having still the red state, the red label of high transmission still in our communities, according to the CDC. This week, we had an accumulated rate of cases of 189 per 100,000 people, which is a little higher than the last week. Nevertheless, the rollout cases for the week in 7 days had a lower rate. So we had 70.6 in the average. Now, the highest rates were seen in cases diagnosed were seen in people between 23 and 34 years. This is a trend that we have been observing at least for the past month, at least consistently. So yeah, we want to find out how to help this group. But we also saw an increase in cases in people between 12 and 17 and adults between 45, 54, and then those 65 plus. Now, in the community, the 23% of the cases were among the Latino population, which is a little high considering that the Latino population is only 14% of our population. So, if you know any Latino, any Hispanic friend that needs vaccine and is having issues, please let's help out them, help them out so that we can have less cases, but also to increase the vaccination. Now, where did we see most of the cases or more cases? Well, 41% of the cases were in Longmont, which is something that we also observed the last time we talked. There was a reduction in the hospitalizations. That was a good thing. And it's also a reduction in the hospitalization among pediatric cases, which is starting to feel good because we're having very, very, very high numbers in pediatrics and also increases. But now we are starting to go lower. And in the whole state, we have 15 hospitalizations confirmed with COVID among kids. And there's around 21 kids, I think 21 kids that are in the study to see if they have the COVID or not, just to confirm it. So that feels better than what we had observed before. Now, in terms of deaths, we had since May, the 19 deaths, which brings us to a total of 275 deaths from COVID. And that means that we have a rate of, we have 84 cases per 100,000 people. That's a rate. And that's less than the national. So we're lower than the national, which is 217 per 100,000. So that's okay. That feels okay too.
Excellent. Well, thank you for sharing this statistics with us. And if I hear you correctly, there seems to be like a disconnect. There's a dichotomy going on right now between the number of reported cases, which are still high on the age groups of 12 to 17, 23 to 34, and 45 to 54. Interesting age group brackets. But those guys are, and of course, the ones that are not vaccinated or can't get vaccinated, which are the kids, right? 3 to 11. On all of those four categories, the cases are going up, the reported cases, yet the hospitalizations are going down. So something's funny is going on there. It's good in the end, because ultimately, and I remember from my experience with this COVID thing, getting COVID is not so bad. Going to the hospital is really bad. Once you have to go there, then your chances, your chances change immediately. So, so in a good way, this is good. This is really good that we see less hospitalizations, even though we are still in the red flag according to the CDC, and we should still protect ourselves as we can, which is face masks, of course, social distancing, washing our hands, and getting vaccinated, which is the only long-lasting solution that we have to beat the pandemic that we're in right now. So thank you so much. And with that, tell us now then about the statistics for vaccinations in our county.
Yes, thank you. This is very important, and it's related to what you just mentioned. So it seems like the things that are happening is thanks to the vaccines, people are, yes, they may be having COVID, but they have less severe COVID or, moderate or, mild COVID, which is still is an issue because some people develop long-term COVID, but it's still, you're not going to the hospital just like you said. So we think the vaccination is showing us this difference in the trends. And also the fact that the kids are using their masking and all these things, that we are doing are working because we are not seeing as many hospitalizations. Now, so then going back to the vaccination, the other good news is that we saw more people getting their vaccine. The increase in vaccination is not really dramatic as we saw before. We don't see clinics with like a lot of people, but hey, we had about 700 people who received their first dose this past week, which is okay. It's a good advance. Anything helps really. And with this, we are reaching 243,500 residents that have received at least one dose, which is 84% of the people who are eligible, and a little bit more than 74% of the entire population, including not eligible. So it's pretty good. I think we're doing a good job there. And we're not saying us, it's everybody who's participating, people getting vaccinated is what is making this happen. So thank you very much for that. But now from those, remember that the final goal with vaccination is to complete your course of vaccination. And we have a little bit more than 78% of the people who are eligible who have completed their vaccination, which is great, their courses. Nevertheless, we still have around 46,500 people who are eligible, but they're not vaccinated. So, hey, we gotta move on, people, we can do this. And with this, the thing is that we have, we're really focusing a lot in having the most people vaccinated. And we know now that around 30%, a little bit over 30% of our population is not really that well protected with the vaccines because of people who are eligible not vaccinating, or people who are vaccinated are not yet completed with their doses, or they are not eligible. So still we have a big chunk, more than 30% of the people who are not enjoying the full protection that, or the maximum protection that the vaccines can give you. So as people who haven't finished your courses, please go ahead and don't forget to do that. Those who are going to be eligible very soon, good news for the kiddos, don't forget about that either. And those who haven't done it because of any barriers or something, please call us, let us know how we can help you. You have questions, you have fears, it's valid, and please feel free to communicate with us so we can help you with that. Now, we're looking a lot at the kiddos, and we see that about 70% of the kids between 12 and 19, well, 19 is not kids anymore, but teenagers between 12 and 19 years old, 70% have received at least one course, which is great. The kids that are, the segment that are leading this tendency is those between 12 and 14, which are 80% of them have received at least one dose. And 76% of the next chunk, which is 15 to 17. And the ones that are being left behind are those young adults, 18 to 19, who are only in the numbers of the 55% around. So, hey guys, I mean, you just became independent, and we understand that the system might be difficult to navigate. Please give us a call how we can help you. It's totally normal to have issues trying to find where to get my vaccine and everything more now that you decide. Because these kids are winning. We can't let that happen. Let's do this.
Yeah. Yeah. So And with that, I'll echo your sentiment. And the thing that I heard the loud and clear from all the statistics is that we have 46,000 individuals that are eligible to get vaccinated that have not. And everything we're doing in this statistic and this effort with the vaccination equity clinics that you guys are running is that to invite everybody to get vaccinated. And of course, some of this 46,000 individuals just don't want to get vaccinated, and that's okay. It's your decision if you want to or not. But if it's a matter of anything else other than you really don't want to for some philosophical reason, then there are so many options out there for you to do it. There are clinics that we're going to mention here in a moment in every single city in our county. So whether you're in Louisville, Lafayette, Boulder, Longmont, Erie, Niwot, you name it, Lyons, Netherlands, there are places where you can get vaccinated. The vaccine is free, it's anonymous, and you have a choice. You'll have a choice of one of 3 vaccines. So we're inviting you directly to go get vaccinated. So we can change, bring this number up to a 95%, which is the ultimate number that we're looking for. We're almost there. And if that doesn't motivate you, then let's protect the little kids from 3 to 12 or 3 to 11. They don't have a vaccine yet, and they are amongst the age groups that are getting COVID more than anybody else. So do it. It's for the community. And with that, Liz, tell us, since you have the best spot to hear what's going on, boots on the ground. You see people all the time, every day, where you go to one of this many vaccination clinics. What have you heard from the community? Why are they getting vaccinated? Why are they not getting vaccinated? Or any rumors or stories that you've heard?
Yes, well, actually, in the English-speaking community mostly, we see still people that are like, well, just because the work said that I have to get it, then I'll get it. But what we see is people actually, they look like, okay, they were not very happy in the beginning, but then they live like comfortable. And they're happy they did it, and they realized that it wasn't really that much of a big deal. And that is great. But also, we still hear people having barriers to access, maybe not so much in the English-speaking community, but definitely in the communities that live far, like in the mountains. And there's people in the mountains organizing clinics and buses coming over there to give vaccination. And if you happen to be in one of those distant, not just the mountains, but distant communities, I can assure you there will be a bus there for sure, because I work with them all the time. And you can find them online, or you can contact us. You can contact me, and I'll tell you what's happening in your community, because the state is everywhere now. So then you can have access to the vaccine, certainly very, very close. So that's what we're hearing a lot. Also, the people who, because of work, they can't afford to lose a day or two for the side effects, because some people present side effects, not everybody. Some people present side effects, and they need at least 24 hours to kind of like wear them out. The good news is that there are clinics like almost I'm sure, well, actually you can find a clinic every single day at different hours. And the recommendation, well, if that's the issue, if you work Monday through Friday, get a vaccine Friday evening so you can wear it over the weekend, or get it on a Saturday so you can wear it on the Sunday. If you work the night shifts and so on, well, how about you get it in the early morning so that you can, as soon as you can, so you can rest the rest of the day. Or, there's so many clinics nowadays everywhere, in the supermarket and so on, even. So yep. Pharmacies. So yeah, that's what we're here.
So the moral of the story is that they're everywhere, and they're at weekends, mornings, evenings. And if that still doesn't work for you, the state of Colorado is still mandating that if you're going to get vaccinated, if you are presenting symptoms, or if you have to take care of a minor or an adult that is getting vaccinated or presenting symptoms, you can take off of work with no loss or repercussion. That means they have to pay you for it, and they're not going to fire you because you're not there. So the financial reason is really not a reason. Maybe you didn't know about it, but now you do. The state of Colorado still is protecting these individuals that have to take care or go get vaccinated themselves, or a minor or an elder, right? Somebody that can't do it for themselves. So take advantage of all these opportunities, and if you want to get vaccinated, go get vaccinated if you haven't done so. If you have one course, go get your second course. I think you guys are still giving $100 cards, right? If somebody goes and gets vaccinated, you guys are offering a free $100 gift card for your first course or your full course, right? So it could be the J&J, which is one shot, and that's a full course, right?
Actually, yeah. So we're doing the gift cards for those who complete their courses. But if you think about complete courses, means you have the second dose of Moderna or Pfizer, and we are offering Moderna and Pfizer, but we're also offering J&J. That's another thing that we have here in the community, that people are having a hard time finding J&J. We're offering J&J, and that's only one shot. So that's one shot is considered a full course in the case of J&J, no Pfizer and Moderna, but J&J, yes. So if you show up to our clinics and you want to have just one shot, you can get off J&J, of course. Then you can get your gift card. Or if you like Moderna and Pfizer, then they'll take your name, and when you show up for the second dose, they'll give you your gift card. So yeah, no, this is great, and you can vaccinate your kid too. If you have a teenager who's eligible, bring them with you, and then you both can spend the time resting these side effects over the weekend or whatever, whenever you need it. But another thing I want to mention that might be useful for workers is that the bosses of the state that are visiting all these communities, including us, they have also flu vaccine now. They're offering flu vaccine. We don't know for how long, but they are offering the flu vaccine, and you can receive both the COVID and the flu vaccine the same day, in the same appointment or the same time you show up. You don't even have to make an appointment. You just show up and say you need both. Perfect. And this is good because some works are asking also for flu vaccine. So this is your opportunity to take them. And some kids, they want to have the flu vaccine, not that the kid wants to, but the schools are like, yeah, that's a good idea because it's also very contagious. Not as contagious as COVID probably, but very contagious. So yeah, that flu is also in the buses now, in the CDPHE buses. If you need information, visit our website, or you can email us and we can send you a list of clinics. All of these clinics appear on our website anyways.
Excellent. So again, all that information is down here in the description. There are links to Boulder County and I think the state of Colorado, but if it's not there, I'll add it. Phone numbers where you can call. They talk to you in Spanish and in English. And if you speak any other language, they have something called the language line. So they can talk to you in one of 75 or 95 languages that they provide assistance to. So please, again, remember to use the protections that our hands, at our fingertips, which are wearing a face mask, is still a Boulder County mandate. Social distancing, washing your hands, and of course, getting a shot, which is the only long-lasting solution that we have. So with that, I think we've covered our topic for today. Dr. Liz, anything else, or are we done?
I think we're done. I just want to say thank you very much for this opportunity to talk to the people.
You are welcome. You're awesome. You're great. I love your energy, and we'll see you again in 2 weeks. So
thank you.
Thank you until next time.